Awesome. So just want to make sure everyone can hear me loud and clear. Could you put a one in the chat for me, please? I'd appreciate that. Awesome. Thank you so much. I appreciate it. And as I share this information with you, let me just go to sharing. So as I'm sharing this, I just want to, of course, reintroduce myself. My name is Kerry-Ann Joseph-McLean. I am a health enthusiast. I'm not a health practitioner. I don't profess to be in the health profession, but what I am, as I mentioned before, is a health enthusiast. We have a friend of ours who sort of stated this in one of his seminars that we are our best doctors. We are the doctors of the future in the sense of not giving ourselves diagnosis in a way of giving prescribed medication, but sort of being in tune with our body in the sense that we want to be able to better articulate what we're feeling, what we're going through as we go to the doctor, whether it's a naturopathic doctor, a family traditional doctor who practices medicine but also prescribe, pharmaceuticals, and also being aware of what you're eating, your mood, everything is connected in a way. So when I share this with you, of course, we're going to have an opportunity for Q&A at the end. Let's do this now. Share my screen. And as I share my screen, please confirm you can see. Put another two in the chat if you can see the screen. I would appreciate that so much if you do that. Can you see my screen?
Yeah.
Okay, awesome. Thank you so much. So as we speak on this, I just want to share you one of the reasons why I'm doing this. My mother passed away about 2.5 years ago from pancreatic cancer. And some of the symptoms I'm sharing with you were this one over my head. She initially had a second occurrence of stroke, which was diabetic related stroke. And the first one, she was able to get up and walk and to recover at least, I'd say 95% of her health. And then 5 years later, to the same month, same week, she got a second stroke, which left her bedridden. And so at that time, I took a hiatus from what I was doing to stay home to take care of my mom because a nursing home wasn't an option for us. We didn't want to have her go to a nursing home. So in that case, it was committing to taking care of her because of her diabetic related stroke. Unbeknownst to us, some other things that were sort of brewing in the background, like a gentle, like a quiet storm. These are some of the things that we missed. I missed actually. And so for me, just to put things in perspective, is that every appointment, every colonoscopy, everything that she had to do prior to her getting the second stroke, as well as while she was bedridden, I was on it. But if I knew, which I'm sharing with you, if you knew that you could actually have the knowledge, the wherewithal to help your loved one to sort of pinpoint things that actually help to prolong your life. And I'm saying this with you because it's important that we become more mindful, more self-aware, because we know we can see the external things. Like for someone says, well, I have my sugar's really high, my diabetes is out of control. We take things sort of lightly because we sort of, the person has to take ownership. But if that person is in that mindset, it's sort of hard, especially when the child is speaking to the parent. And it can happen where, words may go unheeded, and it's hard not sort of the words may go through in one ear and out the other, so to speak, because they may think, okay, they brush it off as nothing important. Not to say that my mother didn't listen, it's just there's certain things that we all miss collectively. So I'm speaking today on pancreatic cancer and the link between your insulin level, diabetes, and other complications. So there actually was a link that we found out after my mom passed. My younger sister was doing a search and she saw this. And I'm thinking, why would the doctor not share that with us? Because they know there may be a link. If you're a diabetic, there's a greater chance. And so for us, if you don't ask, you don't know. If you don't investigate, you will never know. Because doctors are human. They give you the best educated guess. But if you're coming with, your information to sort of ask and challenge the doctor, this will help to sort of avoid some of these things that can be potentially life threatening or even shorten your lifespan. You may not have diabetes, you may not have, issues with your insulin level, but you may know of someone, especially in our community. One of the things I can say with you is that diabetes and pancreatic cancer, we know it is linked. It's not the only reason to get pancreatic cancer, but today I'm focusing on that. One of the main things we think about is good nutrition. We take that, especially in our community, high intake of sodium, sugar, different things can happen in the way of how we eat, in the way of more starch versus more greens can actually have a negative impact, especially if you've been diagnosed as pre-diabetic or diabetic. So diabetes it may be either a risk factor or a symptom of pancreatic cancer. So not to scare you, but what I want to share with you is with my mom, we found out through a nosebleed. And that nosebleed she had twice in a matter of a few weeks. And at that time, she was already at stage 4. So they gave her 3 weeks and she lasted 3 months. And so if you are diagnosed with pancreatic cancer, that might be end stage. So pancreatic cancer at stage 1, stage 2, stage 3, there may be little to no signs, but having the right test or the blood work done can actually help to save your life or actually help you to identify how to correct and to change certain things that you're doing to avoid getting pancreatic cancer. Now, is there a cure for pancreatic cancer? There's no cure for any particular cancer, but there's a way to minimize it. There's a way to help you to reduce the certain levels in your body that may trigger your cancer growth. You all have cancer cells, but how you treat your body, what you do with it in the way of nutrition is super important. So in pancreatic cancer patients, and I got this through everything I share with you are from credible sites. I take the links. You can actually go search it for yourself. I do things. I go search through Public Medical Library, John Hopkins Clinic, Mayo Clinic. I even go to other sites as well. I know that have the studies that are done, not my sake, but information I've found, and I sort of compile them together so you can actually get this on this platform. So if a pancreatic cancer patient who has had diabetes for less than 5 years, it's sort of unclear diabetes contributes to the cancer. But if you've had it for over 5 years, that means you're a higher risk. My mom was diagnosed with diabetes at age 50, and she passed at 77, almost 78. So for 27 years, she had it, diabetes. And then in this case, she could have had symptoms of pancreatic cancer, which were very, very um, almost non-traceable in a sense because looking from your own naked eye, it's hard to determine if you're at risk of pancreatic cancer. So the risk can be there depending on the factors and symptoms that may occur, and keeping in mind that it could be the reverse. So if you have like an onset of diabetes, it happens. Some people go years not realizing that they are diabetic or pre-diabetic until they have some major issue like kidney failure. It's a higher risk, especially for type 2, if you're over 50. So things like that can actually be indicators. So the early symptoms, for example, a sudden change in your blood sugar levels can happen previously where it's well controlled. That's a sign of pancreatic cancer. So one moment you're okay, next moment you're not. That's indicated that something's wrong with your pancreas. So there are many factors that you can actually be diagnosed with pancreatic cancer. Tobacco use, diabetes 1, being overweight, chronic pancreatitis, workplace exposure to certain chemicals. But I wanted to mention these conditions that can actually sort of have you go to the downward spiral of having pancreatic cancer. But our focus today is diabetes and how it's linked with pancreatic cancer. But I just wanted to bring that to your attention. So some of the risk factors of pancreatic cancer could be, like I mentioned, smoking, your age, I mentioned before, if you're over 50, can happen where you can a higher risk of pancreatic cancer, your race and ethnicity, obesity, and of course, I mentioned diabetes. What the risk factors are, as I mentioned, family history. If multiple degrees of relatives have this disease, especially under 50, you're a higher risk of pancreatic cancer. Your diet is one. High in red and processed meats can actually increase your risk of pancreatic cancer. A diet high in fruits and vegetables may decrease the risk for pancreatic cancer. Obesity is one, so anyone who's obese have a 20% higher risk of developing this condition, this disease, compared to those who have normal weight. We've mentioned the race, African Americans, some Jews in certain type of conditions can actually have pancreatic cancer. Smoking is given. It impacts your pancreatic cancer case. Your gender. So slightly more men are diagnosed with pancreatic cancer than women. That's why I believe it's not spoken about in our community, because we've heard someone has pancreatic cancer, it's mostly a man, a male. You don't hear that very often in women. So when you do hear it, it's not where it's like, oh my God, you hear the word diabetes with every other person you connect with. But pancreatic cancer is something that is not well taught about or talked about. So pancreatitis is another thing as well. Excuse me. So pancreatitis, chronic pancreatitis increases the risk. So risk is even higher for those who have hereditary pancreatitis, meaning that you get higher risk of getting pancreatic cancer. The symptoms, as we mentioned, I mentioned with my mom with a nosebleed. Is not part of the list I'm sharing with you. That was an odd thing. That's why I never put two and two together to realize that this could be something with her pancreas. So these are some of the things that happen. For example, abdominal or mid-back pain can be an issue, an indicator. Loss of appetite, jaundice, weight loss, nausea, change in the stool, and recent onset of diabetes. Now, I'm going to put a disclaimer here. What I'm sharing with my mom, some of these things my mom didn't have, my mother. She didn't even have any pain, only to the latter stage, the last 2 months of her life. So all of this time when she's stage 4, no other signs beside her appetite, the texture of the food changed and what she consumed. And we thought that wasn't because she was aging. She developed jaundice, yes. She had some weight loss, yes. Nausea, no. Once in a while, I think once or twice she had some nausea due to something else, but it wasn't linked. Her stool, nothing changed there. And she had diabetes from since she was 50 or 55, I believe. So in my mother's case, when she was admitted to the second nosebleed, which she had clotting coming from her mouth to her nose, the second time, in a matter of weeks, I actually scheduled an appointment for someone to come in to check her liver enzymes because she had jaundice. And the day before that, and her urine, of course, just to see the levels of her enzyme. The day before I admitted her to the emergency, I asked the doctor, attending physician, if they can check her liver enzymes. And he asked me why, and I said, this is the reason why, because of the appointment we had the following day for someone to come into the home to do those tests. I mean, get the actual urine and blood work. So when they did the test on her liver enzyme, they found the mass on her pancreas. And that's where they realized she had stage 4. So that gave us the opportunity to put things in order. Of course, instead of 3 weeks, she lived until 3 months later. So it was sort of like blindsided. So in this case, some of the symptoms I'm sharing with you may not even be some of the symptoms that that person may experience. The itchy skin she had, but only because she's diabetic, and sometimes she had it on her back, but that was what we were told due to her diabetes. But no broken skin, nothing else happened with her. So these are some of the things I want to bring to your attention with that happened in my mother's case, with what I was able to observe. So things you may need to know about diabetes and pancreatic cancer. As we mentioned, long-standing diabetes is a modest risk for pancreatic cancer. Duration of the diabetes, as I mentioned, my mom had it since 50 or 55. The pancreatic condition, that's your pancreatitis or even pancreatic cancer, can actually trigger diabetes, which is the opposite. Clinical factors may identify which people have new onset of diabetes. They're most likely to have pancreatic cancer versus someone who has longer onset of diabetes. And so early detection is important, but you have to be your advocate to say, okay, can you run a test for my liver enzymes, or can you check my pancreas to see how it's operating? And there's certain tests they can do, blood work and certain levels they can check to see if it's elevated or if it's normal. So onset of diabetes in people over 50 who have a low body mass index, losing weight, but they don't have any family history of diabetes. This could be an early indicator that you have pancreatic cancer, or you are actually have been stage 1 or even higher. A sudden change in your blood sugar levels, I mentioned before, with diabetes, who have well-maintained diabetes from before. There's certain indicators of the symptoms, and while pancreatic cancer can cause diabetes, the reverse is also worth noting. So, for example, if you have been diagnosed with diabetes, especially long-term diabetes, your risk factor increases of you developing pancreatic cancer. So, about 80% of people with pancreatic cancer have glucose intolerance. So, below is a PubMed study that I found that actually has more detailed information there. So how does type 2 diabetes how can the type 2 cause pancreatic cancer? It requires a higher level of, level of insulin than normal diabetes. So you're managing your diabetes with the insulin or with the actual capsules, things like metformin and Janumet, other types of medication for to manage your sugar level, your glucose, your insulin level. But if you need more insulin, that means that you have the higher concern for you potentially having pancreatic cancer, or you actually may be undiagnosed because it wasn't something that was considered. So furthermore, if you're thinking of pancreatic cancer, that it can actually come upon you if you're diabetic or you've just been diagnosed. Speak to your doctor, ask them to run some additional tests to check how your pancreas is operating to make sure it's actually performing well. Because thinking of it this way, the insulin resistance is a concern. So if, for example, your insulin is tolerance, your pancreas needs to perform, may have more of a what I'm trying to find is if you have an issue where your pancreas is actually highly stressed, it's trying to create more insulin, this actually can cause an adverse effect. So, for example, if you have loss in insulin production, that actually can impact you. So, either case, it can increase the risk of type 2 diabetes, which can potentially lead to pancreatic cancer over time. So the risk factor I mentioned was before, but how can someone who thinks they may have pancreatic cancer, how can it be detected? Well, the right diagnosis, speaking to your doctor, noting all of the symptoms you're experiencing. I mentioned to you before some of the symptoms that I showed before uh, did not pertain to my mother, except for the jaundice that she had and the weight loss. The diagnosis from your doctor is basically you being proactive and booking an appointment to do the necessary blood work and insisting that you do have that test. I'm not sure where you are in the world, but if you need to pay for that extra to have that test done, then get it done. Get out of the way. Being proactive is better than actually being in denial. The symptoms of pancreatic cancer frequently include things, as I mentioned, about abdominal pain, weight loss, itching, and jaundice. These are things as well I found through the Hopkins Medicine website.org. So there's something else called type 3 diabetes. We have type 1, type 2. So diabetes is a condition where the amount of glucose, for example, the type of sugar in your blood is too high. So the amount of glucose in your blood is called blood sugar levels. It's basically what we know of diabetes. So the pancreas usually produces the hormones called insulin and glucagon. So which basically it keeps the amount of glucose in your blood at the right level. When it's imbalanced, then this is when things happen that are not actually good for your health. So if you have pancreatic cancer, you may not produce enough of these hormones. This means that your blood sugar level may become too high or low, right? So we know type 2, type 1, but in this case, it's the doctors or someone who you're speaking to, a practitioner, will treat this type of diabetes a little bit differently. So we know in this case with the pancreas, in my mom's case, there's nothing they could have done because she's already stage 4, and her age and her lack of mobility, she wasn't a candidate to do in type of surgery to have a stent placed in. She was at high risk of getting pancreatitis because of that. So we opted out not to do those things to have her not be in discomfort or pain or having a higher risk of infection because of, I mentioned those three factors, which is the lack of mobility because she's bedridden, her age at the time was 77, and of course, the recovery time would be more painful because of her healing time to recover. But if you actually been diagnosed stage 1, stage 2, stage 3, you're mobile, there's a better chance of you having the ability to have some type of care. So the reason being that the disturbance with or disruption with your pancreas, it can actually cause damage. So the things that can happen that you may be diagnosed with is called pancreatogenic or brittle diabetic. And so people with pancreatic cancer, pancreatitis, which is inflammation of the pancreas, and people who have had surgery to move part of the pancreas may get type 3, and those who have diabetes or prolonged diabetes or onset of diabetes. So type 3 diabetes is different, as we mentioned, than type 1, type 2. So a lot of information about type 1 and 2 we may know. But one of the things that I mentioned before, in my mother's case, she didn't feel hungry. She lost weight. She wasn't overly thirsty, but these are some of the symptoms that most people experience if they've been diagnosed with pancreatic cancer. So feeling thirsty, needing to pee more often. This can be actually misleading because if you are diabetic and you also have hypertension and you're taking a water pill, you want to have more frequent, your body needs to have more urination because your body is taking, removing all of the excess sugar that your body can't handle. And if your kidneys are trying to filter all of that, of course you need to urinate more. So again, pay attention to those things, but feeling hungry, losing weight without trying to, feeling lightheaded or even confused. In my mother's case, again, it was a mess because she was diagnosed with mild to moderate dementia, which can happen if you've been diagnosed with diabetes, especially for long term. If you're not doing the right things, this can actually sort of um, your dementia can actually be sort of be more severe as you get older because of the combination, we call it the perfect storm of things that you are not doing. Another type of therapy that can be done if you have been diagnosed is pancreatic enzyme replacement therapy, which you can actually do at your own, speak to your doctor about, as something that could be a consideration for if you've been diagnosed with this. So I mentioned before all of the things that the symptoms that you may experience, in addition to what I mentioned before, things like palpitations, sweating could be another thing you want to look out for. Again, in my mother's case, she had a heart murmur, which happened after the second stroke. And so in her case, she was taking a beta block. But that, again, the 2 and 2, we didn't, even though we had the doctors, we had the tests done, all of these things happened. It was messed with the pancreatic cancer. So be mindful of that. There's also a link between sodium, diabetes, and pancreatic cancer. So think of it this way. Most of us, especially from the Caribbean, we tend to have a higher increase of sodium. There's certain types of salt that are oxidized that we shouldn't input into our body. So be mindful of what you're consuming in the way of salt intake. So the amount of sodium we eat can profoundly affect our health in numerous ways. So for example, the average person is supposed to have about 1,500 milligrams of sodium. But there's certain things that have hidden sodium, like our West Indian flavor seasoning. Not to knock them, they taste great, but you have to watch the label to make sure that you're not adding salt upon salt upon salt or having sodium, sort of compounded. So, for example, you may be getting boxed meals, frozen meals may have a lot of sodium because for preserving what you're buying. You may be cooking and adding salt in a flavored seasoning plus salt. The iodized salt versus, other types of salt, like my husband mentioned Celtic salt would be a great one to go to, even Himalayan salt, but making sure you do the research to make sure the Himalayan salt doesn't have heavy metals. So most people will have 3 times or 2 times the amount of sodium that their shouldn't be having in their system. Of course, the body is trying to process all of that, so you're putting extra strain on the body and on your organs, and not just your pancreas. Along with other health complications besides diabetes can happen, which can endanger the pancreas, not just diabetes. And so the certain studies that have shown that people with type 2 diabetes can be 3 times more likely to develop pancreatitis, which can actually lead to pancreatic cancer. So both diabetes and pancreatitis share similar risk factors, which such as obesity, poor diet, and so forth. Some populations, like ours, in this case, we speak about African American Canadians around the world, Africans, so to speak, because we are in different parts of the world. Our population genetics add another layer of risk to not just what I mentioned before. So key takeaways, excess sodium intake is linked to chronic conditions, not just pancreatitis or pancreatic cancer, or diabetes. So be mindful of that. People in the Black or African American community or North American community have a higher risk of developing those two conditions. And though most of us, we speak about hypertension, high cholesterol, and high blood pressure, diabetes, those things can actually cause further complications. So thinking of reducing the amount of sodium in your daily diet can help with your diabetes prevention and pancreatic issues. Now, our body needs some kind of sodium, or I should say salt intake, but be mindful of how much you consume because, again, you're actually doing your body a disservice. So living with mitigating or even avoiding diabetic and pancreatic complications is easier with a low sodium lifestyle. Less salt in your life means less pressure on your kidneys, your heart, your cardiovascular system, while also aiding preventing and managing hypertension. I mentioned that before, which should help you to avoid conditions like diabetes or actually help you to reduce the numbers if you're already being diagnosed with pre-diabetes or diabetic numbers. So since most foods high in sodium are also high in calories, avoiding them reduces the chance of unwanted body weight and obesity. Now, I know, especially from the Caribbean, we tend to make certain things that are high in carbs, high in carbohydrates, less green sometimes. Sometimes we have a lot of meat or protein, and so we have to be mindful of what we do, what we consume. So being mindful of what you're eating helps you with, your longevity, but also being mindful of the frequency of what you're adding to your meals. Planning ahead, doing what you have to do in order to be able to have a longevity of life. So with the right planning and preparations, the way to manage your diabetes, which can help you to lower the risk of pancreatic cancer, is what you eat, what you consume, what you drink, right? Of course, being mindful of your numbers as well to pay attention to that and your mobility. So some diabetic friendly tips for that would be food options. Is of course you can consult a dietitian. In my mother's case, when my mother had the second stroke, our doctor and nurse practitioner referred us to a dietitian, and the dietitian spoke with me. We put a meal plan together. I explained what I was doing. I prepared meals a week to 2 weeks in advance. You prep the food, freeze it, label it, and manage what type of salt intake and sugar intake so that we could manage her numbers, which actually were great. But at that time, of course, we didn't realize she already had pancreatic cancer. So at least you can do what you can within your control. This will help also to sort of be proactive of creating special nutrition plan, especially with you, or if the person around you can help you. Sometimes someone who's diabetic may not have the wherewithal to do that by themselves, especially if they're controlled. They may have higher cravings for salt and sugar, and they may not have the willpower to do that. But if they're able to speak with a dietitian, be accountable for that, have someone to speak to, a family member or even your doctor to refer to someone, that helps you on the right path or better path to a healthier you. So it looks like my life actually stopped. Sorry about that. So one of the things I want to suggest to you is that consider eating plant-based food with plenty of fiber, eat high protein foods, be mindful that you're getting wild type fish or meat versus farmed grown fish and meat, which are high in antioxidants. If you're looking at, sorry there. If you're looking at other things like eggs, make sure that they're not filled with a whole bunch of antibiotics. Antibiotics as well, because that actually helps to interfere with your insulin, especially if you're taking medication. Include foods from each group, whole grains, fruits, vegetables, if your body allows. Some people are sensitive to gluten, so be mindful of that as well. Second thing is what you want to consider is your intake of liquids, juice, beverages. Be mindful of the number of time you're drinking juice. So I'll give you the one of the little tip. My mother, she was so cute. She would get the tall glass, put like X amount of juice, and then add water to it. I'm thinking, okay, that's still the amount of sugar you're thinking you're diluting it, but it's not. So you have to trick your brain. You have to trick your brain in the sense to say, okay, what am I consuming? Measure what you're drinking, be sort of meticulous, and it takes some time and practice, but I know you can do it. So in addition to being mindful, you're sort of looking at different things like, input, what you're consuming, how you take care of yourself. Consider superfoods. So superfoods, for example, are a great way to have the nutrients you need without high intake of carbohydrates. We know that there's certain types of foods we have to consume to have a well-balanced meal, but including that gives you energy, consider superfoods that can help to support your immune system, protect your organs, things that can help you with your brain, your overall well-being. And I'll share with you some of the things that I myself, my family have been able to consume in the way of the superfoods that have helped us in the last 14 plus years. So reishi is the number one actually on the planet for the highest amount of minerals, antioxidants, vitamins in the way of nutrition base, in the way of getting the type of nutrients your body needs because it's considered an adaptogen. So you consume it, it helps you goes into your body and it helps you to the body is meant to heal itself, but if you don't give it the right things, it can't heal. So if you give it the right thing, the body will not lie, tells you exactly how it feels. So things like spirulina is actually great, goji berries, aloe vera, all these things help your body. So as long as you don't have any adverse, allergy to bee pollen, like to bees, that actually is another thing as well you can consume. But for me, like for reishi or Ganoderma is a go-to for us because there's no negative interacting with any medication on the planet. There's over 3,000 case studies done by doctors, practitioners on the different types of benefits that this actual superfood can do and provide for your body. And this is not from my words, but for these actual documented proof of what it can do. And so considering that your body, if it's too acidic, it's not pH balanced, the body itself is misaligned. It's your that's where you have a perfect environment to get your body into from wellness to dis-ease. So if you can giving it the right thing to help it become more balanced, you're giving it the benefits it needs, you see your body performing differently over time. So Gardner lucidum, which is one of the things I've fallen in love with my husband as well in the household for the last almost 14 years. We started consuming this in different ways, but I'm showing you the actual raw mushroom. So it looks like this, a little fan, but it actually has, just to give it a comparison, if you like avocados and in here in North America, they have the little tiny ones. In the West Indies, we have the big ones. But I'll say to you that, in comparison, in the way of antioxidants, you need to have 7 whole avocado to get the amount of antioxidant that one single dose of the Ganoderma can give you in the way of therapeutic dose. So 150 antioxidants from the Ganoderma, or we call it reishi, versus 7 whole avocados. You need to have at least 10 strawberries, 10 cups of strawberries to have that. You may need to have at least 54 cups of green tea to give you the antioxidants that the single amount of therapeutic dosage for Ganoderma can give you without having to elevate your high carbohydrate intake, but also get the right nutrients it needs. So we know that for supplements, we need, omega-3s, fatty acid, like probiotics, prebiotics, superfoods, things like, turmeric. All these things are great for your body. In my mother's case, she couldn't have turmeric. she couldn't have ginkgo biloba because she was taking a beta block. The reason I know this, even though I know these things, you still ask a pharmacist, and they study natural medicine. So I mentioned them about Ganoderma, and they said yes, she can have it because they know that there's no interaction with medication. But when it came to the turmeric or the ginkgo biloba, they couldn't recommend that because it would interfere with the beta block that she was taking for her heart. And so we know that there's sorts of the right type of nutrients we get from nature, but there's certain things that have negative impacts. So for example, back home, we get all these leaves, we get all these things that are great for us. If we're taking medication, we don't know the interaction. But I can say for what I've been able to, the information I've been able to research through PubMed.gov, which is a public medical library, and other naturopathic doctors speaking to and getting information, we know that it has so many health benefits, especially in Japan, in the Eastern world, Japan, where for someone who has a heart condition, they're advised to actually consume Ganoderma lucidum so that it protects their organ. If they're cancer patients, they actually are advised to have in addition to their therapy for chemo radiation, so it protects their organ. So not only is Ganoderma a superfood, it's under the two categories of medicinal mushroom and food supplement. So someone said, how much Ganoderma can I have? Well, because it's a food supplement, you can't overdose on food. And because it's low in the carbohydrates, the way of the amount of calories, very, very low, you can't really say you can have too much because you won't gain weight, so to speak. But of course, it is utilized as a health supplement and medicinal, as I mentioned before. And the reason I'm sharing this with you because we discovered this mushroom, and this put a little bit of background, put things in context. I am not a mushroom person. I just don't like the texture when you're cooking it and eating it. My husband loves it. But because of how it was presented to us in the infusion of beverages that we love, I just decided to consume it, and all I tasted was the beautiful taste of what I'm going to share with you in the different types of beverages. But there's power behind the ingenious way of how the reishi or Ganoderma was infused into what I'm going to share with you. So we discovered wellness with our brand, Organa, which we're so happy to represent to this day. We were customers first. We started consuming it maybe about 2 months, and we said, okay, this is it. We love this. We love what it can do for us. But not only that, for our family and well-being. But we're a brand with a purpose. We help people create better, healthier, and richer lives through sharing of this amazing mushroom. In Canada, we have the permission and natural product number to state that it actually supports the immune system. It can help to fight infections and diseases. And so not only is it the helping with this, it's a plethora of a whole bunch of other things that it can help with. And the difference between what we share on our platform and what we're offering to you as an individual versus what is on the market, there's actually the artificially grown Ganoderma, which is in plastic bags and tubes, versus naturally grown, patent protected, with the right qualifications certified, over 30 plus certification in ground cultivation. So meaning the actual in the plastic bag is still considered certified organic because it's free of pesticides. To our left is still certified organic, but it is as nature intended. That means the nutrients that you get from that is vastly different. So how do we consume this? Well, if you and I, we like beverages like, tea, hot cocoa, coffees, even in therapeutic form, which is in capsule form. You can actually get the benefit, the therapeutic dose in capsule form, but you can actually consume this every day with things that you already like. All we're suggesting to you is maybe switching your brand for 30, 60, 90 days to see what it does for you because the body doesn't lie. It is also offered through our toothpaste, which is fluoride free. I've been using this toothpaste for, like I said, 14 years. I love it. We also have other products as well, which is a skincare, which does not have the reishi, but this one has a lot of all natural skincare, which has manuka honey in there. So you get a well-versed of products that you can choose from depending what your palate likes. For me, my gravitated to sweet, so I love the mocha, the hot cocoa, and then now I've graduated to now all black king, and of course there's another one I'm going to share with you, which I've fallen in love with because it's really good for my brain. So mindfulness in what we do, practicing positivity through wellness, just simply making one small change can have a lasting impact. And I'm sharing this with you because if you look at this way, if you are consuming something that'll help your body, you can actually help to change the trajectory of your health. You have the power to do that. So we took it upon ourselves to do that, to invest in our health. And this is why we're so passionate about this. And that's why we consider ourselves health enthusiasts. So the platform itself, our company Organo, offers 3 different mushrooms. Individually, they're great. They have many health benefits, promoting, not only anti-aging, healthier, a healthy well-being, health benefits, reducing the stress, helping to your body adapt naturally to helping in the wellness journey, helping with your focusing your brain, but they work synergistically together. So Ganodum is one, cordyceps is another, and lion's mane, which helps for focus. This is the new baby to the platform with lion mane, which I actually have fallen in love with. So I'm going to share with you some of these I'm going to go through every one of them, but these are all the findings I found through pubmed.gov. The fact that it actually acts as an anti-diabetic agent naturally helps to lower your blood sugar. Those who have had erectile dysfunction because of diabetes, it actually reverses that. It helps you with blood flow. Your ability with your insulin resistance, it actually helps there. It helps with your glucose metabolism. It acts as an agent to decrease your blood glucose and also reduce body weight over time. Now, the body, if it's highly oxidative in a way of stress level, it impacts you in a negative way. So oxidative stress happens when your body is sort of out of whack, so to speak. So whether you have diabetes, cancer, you've been diagnosed with an autoimmune issue, other things, this actually works as a way to sort of break down the body. So it actually helps to, as an anti-inflammatory, to reduce the oxidative stress. It also helps it actually acts as a blood in like similar to metformin. So the PubMed study at the bottom here, you can actually search it yourself through pubmed.gov. Ganoderma reduces the blood sugar by the same mechanism as metformin. The spores itself, no, I mentioned before the natural growth of the Ganoderma or reishi grows in 3 stages. So it's the mycelium, which is the root of the actual Ganoderma, the fruiting body, which is the main area of how it's grown, and then the seeds. So Ganoderma is a fruiting body. The spores now, which are considered 17 times more powerful than the other parts of the mushroom, that grows into the air, goes on the plum log, and sort of creates another cycle of the Ganoderma naturally. So the spores itself, very powerful. It not only works as helping with your diabetes, but also helps as an anti-cancer, has a lot of anti-cancer properties, not just for pancreatic cancer. It also helps with sleeping improvement, memory impairment, and prolonging your life. The Ganoderma also, if you have been diagnosed with diabetes, which I mentioned before can actually lead to pancreatic cancer, this impacts your hormonal and neurochemical changes. So it's sort of like if you're going through moments of anxiety or depression, which can be linked to diabetes because your body is stressed, you can actually go through a moment of anxiety and depression. So this actually helps to calm the body down. Your Ganoderma lucidum, the actual spores, which I mentioned is 17 times more powerful than the actual fruiting body, helps to manage your hypertension, if you have insomnia, sometimes of cancer, and diabetes. Also protects your organs, including the liver and the pancreas. If you have moments where you're feeling really tired, which is one of the symptoms for pancreatic cancer, it actually can be considered as anti-fatigue, which aids in helping you to sleep as well, to sort of helping to calm the body down and the mind down as well as you do that. Another part of Ganoderma is many of the things that we found in the way of health benefits. One thing, of course, it helps with reducing your inflammation in your body. So this is how it actually looks as the package, the actual capsule in the therapeutic form. And so I consume these myself, and so we have customers who've given us lots of feedback. But consider it this way, as if you're consuming regular vitamins, nutrients, most times you consume it and then you actually pass it out, percentage of that. And sometimes when you pass through your nutrients, you may see the smell of the actual vitamin or see the color change in your urine. Whereas with this one, if you're taking the Ganoderma spores, it actually, our brand, it stays in your body 99.9% absorption rate versus what's on the market grown in plastic bags considered certified organic, 4 to 13% absorption rate, which is way less than what we actually are able to prove with our products. And this is reishi, but one's grown naturally versus one growing artificially. So if you want to consider unlocking the potential for your health and you embark on a journey with us, consider any of these as something that you can add to your health journey. So think of it as you're giving your body the right amount of antioxidants, the right amount of nutrients, vitamins that your body needs and will absorb, and to be able to see over time, because the body doesn't lie, tells you exactly how it feels. Not only is it high in polysaccharides and triterpenes, which is what we find in all our foods, it actually alleviates oxidative stress, as I mentioned to you before. Cordyceps is another one. As I mentioned before, the 3 different mushrooms. Cordyceps actually helps with it inhibits the activity of pancreatic cancer, meaning it actually minimizes and reduces the symptoms of pancreatic cancer. It demonstrates as a very effective anti-inflammatory and anti-tumor drug or medicine. It also promises to be a very therapeutic option for pancreatic cancer in the studies that I've found. It actually has immense health benefits. Not only is it going to help you with your appetite, it helps with boosting your stamina, protects your immune system, especially if you have to do therapy for cancer, protects your organs, protects your immune system, helps with longevity, your libido, your memory, and your sleep. As I mentioned before, it's anti-fatigue. So is the Ganoderma. It also helps with managing chronic inflammation, which can happen over time as you're consuming medication and the body becomes very inflamed over time because you have these health conditions. Not only that, it acts as a longevity promoting tonic for endurance and strength, helps performance by reducing the stress or basically getting rid of the stress to improve overall psychological health. Because once you have been diagnosed with a condition, the body becomes highly stressed, highly, in the sense of being depressed, stressed, mood changes. All of these impact you as you're going through a health condition. The lion's mane I mentioned before, which is the 3rd mushroom, which is considered one of the superfoods, which I've actually fallen in love with. This helps with the brain, the function, helps with your cognition and your mood. But not only that, it actually supports your brain and gut communication. So it's actually great for the communication of the gut-brain axis, supports your cognition, and boosts your focus and concentration, because it can, going through pancreatic cancer can actually, and diabetes can actually alter your not only your mood, but also give you moments of confusion. How do you get these all 3 into one to consume? Well, there's one of the newest in our family of beverages is the Royal Coffee. Now, coffee itself, we know, for people who have high blood pressure, they cannot have coffee because it spikes their numbers. Well, with this, it actually does not do that. Any of the products we have will not spike your diabetic numbers. It will not spike your high blood pressure, and this has been proven as well. But in this one, you can get all 3. And I love this because I found a huge difference for myself when I consume it. As I'm sharing this with you, keep in mind that not everyone drinks coffee, not everyone drinks tea, but you can actually consider the therapeutic capsule, which are vegetable casing, you can consume yourself or both. I love the fact that there's a wide variety that can suit, cater to your palate. Right now, we have a promotion where you can actually get free shipping in North America if you were to order $50 Canadian or US, and that could simply mean 2 boxes of a product or 1 box of the Royale, or even the capsules themselves. And so consider doing something for yourself in the way of investing in your health. And if you consider that, take that leap of faith and consider investing in what you would like to have in the sense of maybe switching your brand at least for 30, 60, or 90 days and see what happens to you in the way of how your body responds. Now, as I do that, I want to open the floor, I should say, or open the mics for anyone who has a question. And I'm going to actually read. I'm going to read any comments here, but if you have a question, please feel free to ask. Okay, as I'm looking at this, I'm reading some of the comments here. So someone is consuming the spores. Yeah, so that's awesome. I'm taking the spores as well. And then yeah, eggs actually because if it's not free range or if it's not corn fed, not corn fed, sorry. If they're not fed with things that are non-GMO or if they're consumed, they actually inject or give the chickens lots of antibiotics so they don't get sick, so to speak, and other things, it goes through the eggs. So be careful of that as well, especially if you have something called gout. That's something that I learned as well. Says here, okay, so these are the questions. So any other questions before we wrap up? Awesome. Well, I want to thank you so much for your time. Have a great evening. Take care. See us here next time on next Tuesday, that we can have a different topic that we share information and insight on. And, I'm so happy that you took the time to invest in you, in your health, and gain more knowledge. And hopefully you can take some information away and pass on to others as well. Feel free to invite others. If I send a direct invite to you, but you have others you'd love to invite, please feel free to share with them as well. All right, have a great day. Take care and blessings to each and every one of you.